Hi there. So thank you so much for joining us. Nice to see some familiar faces there as well, and hopefully some new ones will be joining us. So I'm Yvonne Diaz, and I was diagnosed with ALK positive lung cancer in August 2021, and we're hosting today a lung cancer patient advocacy call. This call is being recorded, by the way, so if you don't want to appear, just turn your camera off, and you don't have to say anything. You can also just chat in the chat service. So we want to make this very interactive. So please use the facilities available. And I'm joined here by a few other patient advocates who will be introducing shortly. I thought I would cover the genesis for this project. The reason I'm doing this is I was fortunate to have been selected to attend the World Congress on Lung Cancer last year in Singapore through a travel grant. And actually, that's how I met two other participants who are here with us today, Annabelle Gurwitch and also Graham Hall. And one of the things you need to do is you need to do a project. So this is actually my project. I thought I was really inspired, as all of us really here and involved in patient advocacy. What can we do to really encourage more patient advocates into supporting lung cancer? We've already seen the tremendous work that other patient advocates have done in other cancers like breast cancer, prostate, and others. So how can we do more together? So this is part of a three-part series. This is episode 1, where we're really just starting on the basics. There's no right way or wrong way to get involved. I thought we would start first by introducing all our guests. I'll have everyone go around and briefly introduce themselves. We also want to survey people in the audience and find out a little bit more about you. So we'll just do 2 quick polling questions. But like I said, we want this to be interactive, so feel free to maybe also introduce yourselves in the chat. What's your name? What's your connection to lung cancer? And we'll take things from there. So I'll just hand it over to Annabelle first, and we'll come back.
Hi, Yvonne, and hi, everybody. I'm Annabelle Gurwitch. I live in the United States. I was diagnosed with stage 4 lung cancer, EGFR positive, in the spring of 2020, right in the middle of the pandemic. Oh, so much fun. What I want to talk about today, and by way of introducing myself to this topic, is this: how do we all engage in advocacy while we're all still, some of us working, we have family lives, this work-life balance and advocacy. And this is something that I'm trying to do. I'm an independent. I'm affiliated with a number of organizations. But I think, first of all, one of the most important things we do is connect in ways like this directly to each other to try to find the landscape of what is important in terms of how we find our purpose and how we use our individual skills, how we build skills towards working towards advocacy. And one thing I do want to say is, I think what's really important for all of us here is that, we are this first generation of people living with lung cancer. As we know, the survivorship rates were so low in the past. And Caleb can speak to this, which is how Caleb got involved in advocacy, that telling our stories as a patient advocate is one of the ways, and just lung cancer awareness, knowing that everyone with lungs can get lung cancer, is a first really important and really essential thing to do, because there's still lack of awareness. And then from there, there's all the other kinds of engagement that we're all going to be talking about today. But I do want to say that even that one first point of action of awareness and sharing a story is, for people with lung cancer, doing a great service to everyone in the communities we live in. So I'm really happy to see you here, and I'm hoping for a really lively discussion today. And I'm always astounded and impressed by all the efforts everyone is making around the world. So really happy to be here.
Thank you so much, Aurora.
Hi, everyone. Good morning. Thank you, everyone, for being here. I know it takes a lot to jump on a Zoom call besides everything else you have to do in life. So thank you so much for being here. And my name is Aurora Lucas. I'm currently 31 years old. I was diagnosed, well, first symptoms showed up August 2021, but I wasn't diagnosed until about 3 months later, December 2021. And I was only 28 years old. And because of what I'd gone through with the medical system here in Illinois in the United States, I'm very passionate about advocating, first for myself, but also for other patients. And I found this passion through TikTok and Instagram, actually, because when I think about the system, I get really overwhelmed. And I'm like, okay, what is the best way to empower other people? And it's really to share stories and empower other people and kind of help them navigate the system, right? That's one thing that we could actually do. And yeah, I think social media is very powerful. So I'm open to questions about that.
That's really helpful. Thank you so much. Caleb.
Yeah, thank you very much. Thank you everyone for being here. This is a nice what's it called, forum to talk more about patient advocacy, and not just patient advocacy in general, but patient advocacy as it relates to thoracic oncology, lung cancer. And my brief story is that I have been a patient advocate for over 15 years. Started my advocacy in 2008 when I lost my aunt to cervical cancer. And all I was doing was around cervical, prostate, and breast cancer. But something happened in 2017 that changed, the course of my, patient advocacy journey. Someone that I knew very well, a guy that, we knew definitely didn't smoke because of his lifestyle, up to do, great lifestyle. He never smoked, so he had lung cancer, and I was like, why would he have lung cancer? I never smoked. As a patient advocate, dealing with breast, cervical, and prostate, my mind was, okay, there's no need for advocacy in lung cancer. Why? Because if you don't smoke, you won't get lung cancer. So that was a great shocker to me, and it passed on quickly. And I, reached out to Jill, who is a, great member, mentor in our community, and she, from there, my eyes were open, and I, decided to dedicate my advocacy to lung cancer. I look forward to hearing different stories from different places, and what I try to do in my patient advocacy, it's when we hear the science and the stories and everything, I try to see how do I shape it to my own environment, having coming from Africa. So thank you very much for having me.
Thank you so much, Caleb. Graham, live from Perth.
Hi, I'm Graham. I'm from Perth, and that's a Perth in Western Australia, not Perth as in Scotland or any other Perths around the world. I was diagnosed in 2018 with lung cancer. I was actually diagnosed first with prostate cancer, and incidentally, they found the lung cancer, which probably got it earlier. I started advocating around 2018, just soon after diagnosis, more because I saw a disparity between the two cancers. The prostate cancer was awesome. The support was fantastic. In Australia, there's prostate cancer nurses. They're distributed around the country. In comparison, lung cancer had I think there were at the time less than 5 for the whole country. So it was a chalk and cheese for support. So that's what got me into advocacy. Since then, I have started a charity last year for I have ALK lung cancer. So for ALK patients in Australia, because I saw a bit of a gap for those patients with treatment options compared to the rest of the world, because all the healthcare systems are slightly different, and in our own countries, I think we need to just fill those gaps.
Wonderful. Thank you so much, Graham. And Summer.
Hello there, everyone. Thank you so much for joining us. I love this project that Yvonne has pulled together, bringing us all together with this common bond. My name is Summer Farmen. I'm from Hershey, Pennsylvania. I have been an advocate for the past 23 years, not necessarily lung cancer, though. It started when my son was born 23 years ago at 1.5 pounds, 656 grams. And so I was an advocate for children with special needs and different medical needs, and fighting the good fight with him. And then in 2020, I launched into the lung cancer realm after being diagnosed with stage 4 lung cancer. I wanted to empower myself. It was healing. It was therapeutic to give back to others. And exactly what Annabelle was saying, to, spread the word that anyone with lungs could get lung cancer, that biomarker testing was critical, that we're living with lung cancer. The faces of lung cancer are different than this, what you picture in your head. It comes in, nobody's immune, and it comes in all shapes and sizes. So I steered into that and am happy to be doing it. Like I said, it's therapeutic. Would I pick this path? Not really, but I'm happy to be here with all of you today. So thank you for joining us.
Oh, that's really helpful. Thank you. And also thank you so much for everyone who's introducing themselves in the chat. It's really nice to just see where everyone's coming from and what brings you here. So thank you for doing that. I thought to find out a little bit more about you, we would do a couple quick polls just to see who's in the audience. So Summer is my trusty Zoom.
Yeah, let me help with that. And also, I can't remember, Yvonne, if you said it earlier, but just so everyone knows, we are recording this with plans to post it later. So if you do, in fact, unmute later and speak, if you're uncomfortable with being recorded, you might want your camera off. But shout it loud and proud, everyone. So here we go. Which of the following best describes you? I'm living with lung cancer, I'm a caregiver or family member, or I work in industry or have another connection to lung cancer.
Okay.
Okay, sorry. All right, so 83% are indeed living with lung cancer. We do not have any caregivers here today, so that was 0%, and 17% of you have a different affiliation, either industry or something else. Oh, here, I could have shown you right here.
Oh, there it is.
I
Thank you.
apologize. So here is this one, which best describes your patient advocacy efforts to date. You're motivated, but not yet started, focused on sharing your story, active on social media. That alone is a great way to start too. I've done some public speaking, or all of the above. Wow, this is awesome. We have a lot of active people here. This is great. So some people are motivated, but not yet started, 19% of you. So hopefully today, this will give you that little push you need. Or when you're ready, you'll have some of the tools. 12% of you are focused on sharing your story. 23 are active on social media. 8% of you have done some public speaking, and 38% are all of the above. That is fabulous.
That is amazing. So thank you so much. And I think it's really helpful to know who we have here, and obviously seeing a few more people joining us. So thank you so much for if you're just joining us. We're just going to get now, we'll move into some of the questions I have. And really, like I said, I want this to be interactive. So just add your questions. If you want to come on camera and ask your question, that's absolutely fine. If you prefer to use the chat, that's also great. But it's really just about sparking some dialogue here between us. I wanted to start with Annabelle, and Annabelle jokingly refers to herself often as a cancer slacker, but I think is anything but. She's so active. I mean, since diagnosis, you were already active as an advocate beforehand, but since diagnosis, you gave the opening address at the IASLC in Vienna, at Women Against Lung Cancer in Rome. You're going to be moderating 2 panels this year at World Congress in San Diego, and also also giving some survivalship oriented conferences around the US and also one in Brisbane. So clearly getting around. And also you do a lot publishing, using your writing to get into some really important top tier media to really raise attention around these issues. So I think you're an amazing example of how do you use your own skills. So I wonder, could you maybe elaborate on that a little bit more? What advice do you have for others?
Oh, thank you, Yvonne. You know, and I got so excited, I was raising my hand because there's a question, and this exactly speaks to that I wanted to ask people who are here, which is, how much time during each day or each week do you spend on advocacy? Because I think this is a really important question, particularly for people who are getting involved in advocacy, because it's a lot to balance being in treatment, also working, and if you're not working in the industry or you know, a paid employee or founded an advocacy group that is your full-time job, this is a lot. I am an example of someone I'm a freelancer, I'm a writer, and so I am constantly balancing my need to make a living, my being in treatment, and the advocacy I do. And so just to give you an idea, I spend part of my day every day trying to continue my education. As we know, the science is moving very quickly in lung cancer, and that means that there's a number of issues that are constantly changing that I feel I need to keep abreast of. And one of the entrances to advocacy for me is to be a part of the IASLC and to also follow the major organizations that are providing vetted news and information. So, you know, places like Longevity, if you're not familiar with them, Go-To Foundation, Lung Cancer Foundation of America, Lung Cancer Research Foundation. These are all vetted organizations that let us know what's happening. And I think this is one of the issues for advocates. It might, you know, what I do publicly, you know, in my public speaking and attending conferences and speaking at conferences is really sort of the tip of the iceberg of how I spend my time, because I spend most of my time as an advocate in my position. What I'm doing is, okay, what are my skills? How can I use them for this cause? I've been involved in sustainability advocacy for years, and then in housing insecurity advocacy. And so what I've done is taken that model that I've used to lung cancer. So I will research topics that I will become aware of at conferences or through various organizations, so that I feel I can write about and get attention for in the press or have an impact in through legislation and being involved as a spokesperson towards that. So most recently, just as an example, when I myself had an issue with a third-party insurance adjuster, which I didn't even know existed in order to get my medication, when my insurance changed, I found myself in this crazy system. I first had to try to understand that, did the research for that. I ended up writing about a piece about the predatory insurance practices, which was published in the Washington Post. Then I went on NPR stations in the United States to get this attention. That through that public outreach I did, I got affiliated with an organization trying to change the laws, became affiliated with a coalition to stop this predatory practices through legislation, which lobbies state by state and our national government. So trying to focus in on an issue that I can wrap my head around and get my time to. And the question of hours per week, oh my gosh, you know, this can sometimes take over my life. And I have to take a step back, and I want to encourage all of you to not feel, to try to resist the overwhelm and say, okay, I can, I try to spend a few hours a week at least. And sometimes it's an everyday process. It really depends. If I've managed to get ahead in my work, then I can spend more time. So I'm behind on my project for IASLC's travel grant. I actually am very excited. I'm starting a partnership with Longevity to work on a project on biomarker, bridging biomarker targeted inequities in the South in Alabama in the United States. But I mean, I'm spending time every week. That's the case. Although I took about 3 weeks off recently to deal with health issues I was having. And that's hard, to not feel like I'm falling behind. But I think it's really important to affirm that we each do this. And I'm really love to hear, Graham, you're talking about how you had been involved, you stepped back, and then you started this organization because you saw a need. I think that's a great model of, compassionate advocacy of, you've got to take care of yourself. You've got to keep your life going. A lot of us have families, children, things, jobs, and then stepping back in and not feeling like you're letting yourself and others down. It's a really hard thing because we're all here for the same reason. So however much time you can find, and for me, I do spend time every day researching, and then there are, I will try to spend at least 1 or 2 days a week working on some of my long-term big projects. So if that's okay to say, throw it to you, Graham, I'd love to know how you organize your life and your time.
Yeah, sure. So I do things a little bit differently. My technique is more, I like to block a chunk of time. So I will go, okay, tomorrow or the next day, those couple of days, when I've got some free time, as in I have a wife that works and I have teenage boys. So when they're all out of the house and I've got some peace and quiet and it's only just me and the dog, then I basically will go, right, well, I've got a couple of days and I will head down and try and get all of these tasks knocked off. And then I'll walk away from it for the next week or maybe a few days, 4 or 5 days, because I find that if I'm not buried in it, that's probably the wrong term, but if I'm too involved in it continuously, then it becomes my life. And I find that my balance with, sometimes I like not to think that I have lung cancer. I still do, and I still accept that I do have it. But there are moments in life where you kind of almost forget that you've got to do all the other stuff. And you go, you know what, that's a nice way of sort of living and getting that balance back. So for me, I bulk things up, knock them off in a couple of days, and then have a break, and then go back into it. And I've also, I suppose I started early telling my story, and that's how I sort of started an advocacy for some of the other larger organizations, and they gave me a lot of support. And then over time, I've sort of stopped. That's not me. That's not how I work well. So I kind of now am leaning more towards, we've started a charity, but also doing the patient research advocacy. So I'm sort of looking at where I kind of fit better and where my skill set fits. And I think that's the message for anyone looking at advocacy. You might be, even just telling your story actually does inform other people about lung cancer, and you don't realize the impact that you give to people just by doing that. And they're not going to feed that back to you necessarily, because it might not dawn on them for some time, but then later on they go, oh, I get it. Or, oh, I understand. I know someone else with lung cancer now. Oh, I won't judge them that they must have smoked. Maybe they just got lung cancer because they have lungs. So it's just that you will never know the impact that you actually make long term. But that's how I sort of, on time, that's how I sort of juggle it.
That's so helpful, Graham, because it is hard, right? We're trying to live our best life. We're trying to make a difference. We're trying to further these goals, and it's so challenging. I saw Dana here in the comments wrote, even by wearing her shirts in town, just showing a different face of lung cancer. I think that is so important. So however you do it, it is making an impact, right? And just do little bits, and whether in chunks or, just a little bit in 1 week, that's fine. It also brings me to Aurora, some of the work you've been doing, getting out there, sharing your story. You mentioned TikTok and Instagram, and I think showing your face, right? Such a young face to have been impacted. I know one of the things you talk about is imposter syndrome, also, minorities, and getting more minority voices out there. So maybe you can tell us a little bit about your thoughts about overcoming these issues, particularly the imposter syndrome. It is uncomfortable getting out there talking about lung cancer, and I'm sure there are days where you just want to just have a, just a normal day, right, where you don't think about it all day.
Yeah, definitely. Given my background, I'm a teacher, not a doctor. I mean, I'm in my second year in my PhD program, but my first social media post was actually on YouTube. And if you search it, there's like only 200 views. And I'm like so nervous. I was probably shaking. But I remember rewatching that video and I was like, oh, like I was just like, I didn't like hearing my voice back then. But if you see my TikTok videos now, I'm a little bit, I mean, I'm more confident with my videos. But how I talk myself through it is that somebody out there is going to see this. Because I remember being a patient and like not being diagnosed yet, knowing there was something wrong with my body, and I was going on like that Google rabbit hole, and I was just like crying my eyes out like quietly because I had a roommate in that room, and I was just like, all the statistics on Google are just so outdated. But if we have more updated stuff on social media, then maybe it could help somebody else out there. And that's like the motivation that I have, because there's not enough representation. And one of the more powerful and accessible things for all of us is social media. And I do get like direct messages like, hey, my doctor won't do this. And I'm like, no, please like ask for this and ask for this. And I'm like, it's better safe for you to get these tests than like not getting them at all. And it's such like a normal thing for, I think, a lot of us here in this room, right? Where a lot of us maybe we're looked at and we're like, you don't look like the face of lung cancer. And so maybe it helps reach that goal of like, maybe somebody can get diagnosed at an earlier stage.
That is so true, right? I mean,
Mhm.
so many of us who don't fit the profile, you start to ignore, think, put it off to anything else, whether it's allergies or whatever you might blame for, this strange symptom if you're experiencing one even. So thank you so much for that. And it's amazing because someone looking at you today, seeing your videos, might not imagine that you had that feeling in the beginning, right? Will people even watch, and how do I do this? So yeah, your videos are amazing. And I wanted to go to Caleb. I mean, your history in terms of your involvement in cancer, and especially the other advocacy areas that you were involved in, and we talked a little bit about how even the work in your country can be very different, because sometimes it's also breaking myths, right? When you were sharing a story about your friend, a close friend, who was diagnosed with lung cancer unexpectedly. So everyone's advocacy work, I think, also can look very different depending on the country that they're in. So tell us more about your work in Africa, Nigeria, and elsewhere.
Yeah, thank you very much, Yvonne, and great. Yeah, like when we were discussing, the last time, myself and both of us were discussing. We talked about what I was telling you about was, in every country, the advocacy is different, right? What you have in the West is different from what you have in Africa. So when I am in any meeting or any gathering, I try to take it to my own context, how it relates to what we're dealing with, in Nigeria and in Africa. And it's quite unique. The standard of care is very different. almost as day and night, that difference. And what we decided to do, myself, Jill, Opal, these are mentors that have, mentored me through the way. And I'm like, okay, what do we start with? It's like we have nothing. So where do we start with? And what we, decided to start with was to, first of all, understand the burden and, get people together to, talk. And, we, and I think it was 2018 or 19 that we came together and we started seeing how to get a group together, or a conference or a meeting centered in the continent and around, thoracic oncology. And we, fought, pushed, and advocated, to IASLC, and got the CEO, Dr. Karen, involved, and now that has metamorphosed into something that's, sometime, in January next year, there's going to be a lung cancer focused, conference, in Ghana next year, where IASLC would have like the same way they have, lung cancer meetings in Asia and other parts of the world, they would have it in Africa. So that's actually helps, discussion around, lung cancer within the health, care providers and, the doctors and nurses and everyone involved in the care of the patient. So that's one angle. We called it, the long or the big, projects, and we had other smaller projects we're, working with. So example, in a hospital in Nigeria, most times, one called National Hospital in Abuja, for a patient, when a patient lung cancer, or even when the patient comes, in the cancer unit, they want to see the doctor and they're critically ill, they have to like walk long distance, sometimes like 10-15 minutes, work, to get their blood drawn, and they have to do the same thing to get the results. And, that was like a daunting task. So we came together, to form a phlebotomy unit in the cancer, center. And what has happened there now is that there's someone there that draws the blood for, and we are the ones paying, the phlebotomist, not the hospital. But we hope to hand it over to the hospital, at a point where they would carry on having like a, the proper, the phlebotomist, someone that collects, goes to drop the sample at the lab and brings back the results, So we called it, and because UICC had, for 3 years, they had a slogan, bridging the care gap. So we use that as our slogan, whereby we bridge the care gap, so that it makes it easy for, patients, when they are, people with lung cancer, sorry, when they come into the clinic. So, we have difference, because one thing again as well, the painful part of it is that a lot of people with lung cancer in this, in Africa, they die quickly, right? They get diagnosed, one, they are diagnosed late, and when it's found out, it's already, too late, and, they pass on. Myself and Jill, we've tried to, intervene in, most of those cases, and before it's, they are no more. So the way that, and this was the way it was in the West, right? Like Jill told me 10, years ago, that's the way it was. So we are hoping that as with this effort that we're putting together, getting the health, the doctors, the oncologists involved in this, it makes it easier that they find out what is happening in the West, and we can, import that and get people in our community and our area, to live longer.
That's amazing. It also just shows the power of, convening organizations like IASLC, talking to other people, right? How do we learn from each other and take those best practices to our countries, implement the local versions of those projects? So that's wonderful to hear. Thank you for that.
Can I make
Yeah.
a little comment based
Please.
on what you just said, Caleb? I think it's an important thing to think about when we're thinking about advocacy, who our audience is, who we're speaking to. And there's a lot of different ways to do this. Aurora, you said that at first it was, being on social media. Not all of us want to engage in that way. We all have different ways of engagements. And one of the important constituencies that we all all of us, whatever our skill sets, have a chance to be involved with an advocacy is talking to providers, as about survivorship issues. One of the opportunities that we have, a number of us, and not everyone in this meeting, are on targeted medications. And these are so new still that not every oncologist that you are working with really understands the survivorship issues. And each one of us that speaks up in that kind of dialogue, or that I want to mention as well, I am on the editorial board of ASCO's lung cancer, writing for patient advocates at cancer.net. So if you want to write about your experience, you'd rather do that than make videos on TikTok. I think there's many, and you want to write about patient experience and experience you've had in care, you have a direct chance to reach a readership of providers that really need our feedback. So that's another kind of engagement. And, I tend to do these very long research projects. Just want to say, Aurora, I posted a video though, when I was getting a scan a couple of months back. Yeah, I was a little high. I had taken a gummy, but I had, it was to let people know they didn't have to change into those really horribly depressing outfits for a scan. You can wear your own clothes as long as it doesn't have metal. So I made a stone video of myself in my kooky outfit doing yoga and like singing in a scan room, which you can do too, whatever you need to do to make yourself comfortable. And so, there's lots of different levels of engagement. Yeah.
I love that. That is so good, on so many different levels. But I know exactly. I mean, my background is in public relations, and someone who works in PR, my skills are always like promoting other people, what people do. And so when I found myself diagnosed, it was a very uncomfortable space to talk about myself. I've had to get comfortable with that, and I don't know. For me, at least, I just felt like I can't be an advocate without telling my own story. It's not, I don't think I necessarily have the most interesting stories. I think everyone's story is so powerful when you just listen to what everyone's been through, how you got diagnosed, what people first might have thought you had. Even like you said, Annabelle, not everyone has a biomarker, right? I mean, I was seeing some TikTok videos. There's a young lady, I'm not sure if you're following her. I can't remember her name now. Is it Amber? It's something with an A. But anyway, she doesn't have a biomarker and she's very young. So, and she put something out saying how I feel when people ask me what biomarker I am. Ashley, thank you so much, Aurora. That's it. So it is like, gosh, that's really difficult. So yeah, finding a community, I mean, finding whatever it is that makes you comfortable. I think that's great. And so I do enjoy hearing what everyone else is doing. So again, just feel free to use the chat to talk about what kind of advocacy you've gotten involved in. Some of the people I happen to know on this call, and I know all of you are very involved, so don't be shy and share a bit more about your efforts. I did want to come to Summer, and before, again, just feel free to add questions. We'll take questions live or just read them from the chat if you have any. But Summer, you talked about your own advocacy efforts and looking after your son initially, and then having to then use yourself. So and you've obviously done lots of different things, from telling your own story, advocating for biomarker testing, joining an established organization, getting out there, running like these amazing forums. Summer at ALK Positive runs these amazing forums called ALK Talks, along with Dana, by the way, who's also on this call, and a few others who we bring all these clinicians, researchers, specialists who talk about all aspects, from research to clinical, survivorship issues. It can be about anything. So really amazing. So maybe just tell us a bit more about your journey and what you've been doing so far.
Thanks, Yvonne. I would say I'm the delusional one of the group, that I totally forget I have lung cancer. And I'm in a really fortunate position, I guess. Not that I don't have scans every 3 months. But I think that because I advocated for somebody else for so long, that it's like out of body, I guess, until I lose a dear friend, or, have a scare myself, or those scans run around, or deal with an insurance issue for sure. But most of the time, I'm just like in the grind, getting stuff done. This has now become, for my 23-year-old, we joke, Yvonne knows him well, that he's the ALK positive intern. And he's in my meetings with me. So we're, talking about stuff later at home. But like I said, too, it is therapeutic for me. The people that I met, it's healing, whether they have a biomarker or they don't, or just, and Caleb, like yourself, immersing yourself in this and supporting others without your life necessarily being on the line this second to give all of that time is, I'm so grateful for that and all the people that you serve. But yeah, it happened quite naturally for me. And also, many of you that know me know that my dad actually had a career in clinical trial development. He had worked with my oncologist, actually. He worked for a pharmaceutical company, but he had had a connection with her. So I had always grown up talking about cancer at the dinner table, or so again, it kind of happened naturally that I would tell my story, and then diving in almost immediately from the second I saw the first ALK talk. I knew those people, which it had just started. I think it was the first one ever, but I didn't realize that these people would be my friends. That special education, ironically, is my background, which came first, the chicken or the egg. Yeah, my career. So to empower others, initially, I just knew that I would be doing that, and to make this more than about myself. So
Thank you for that. Thank you, Summer. Caroline, you had a question in the chat. Did you want to come on camera and say it, or do you want me to read it out? Well,
Oh, I remember when I was first diagnosed, I was on a message board, and someone with a very unique name, I also have a unique name, was saying that they were applying for lots of jobs but not getting them because they had done a lot of public advocacy. I'm actually retired now, but if I do go back to work, I think about that sometimes, like, how much do I want my name out there, because it is very Googleable.
Annabelle, I see your hand up. Do you want to jump in?
I think that's a real issue, and I don't want to sugarcoat that. As someone said to me before I started writing about it, you can't untell people when you go public, particularly with something that is being treated now as an ongoing chronic condition, until we run out of, plans, you got your lines of treatment. And I think it's real. I was recently at the KRAS conference in Charlotte, and someone else shared that they were going to, they had done 2 job interviews. One, they had said they were in treatment. One, they had not said they were in treatment, and they hadn't gotten the first job. And they were pretty convinced that even though it's not legal, that this had happened. So I don't think we can sugarcoat that. I think it's understandable. I do think that there are different kinds of advocacies, that if that is a concern, I think, first of all, we have to absolve ourselves of feeling badly about that. These most important thing is we have to take care of ourselves, support ourselves, and do what's right for ourselves. But I think that there are ways to be an advocate, to be maybe associated with a pre-existing organization where you can be involved even in research advocacy, which participating in giving feedback to trials. I mean, there's all kinds of things that don't involve publicly sharing your story. And I think that's a really important thing that we do as patient advocates. And I really respect and understand that concern. And I want to affirm that for you, that's understandable.
Thank you. And Jeanette, I see your hand up, and I saw your comment. I was just going to actually refer to you. So perfect.
Thank you. And thank you for those comments. So I've had very similar to that. So I was diagnosed in January 2011, and I'm self-employed, and I have never told anybody that I work with that I have lung cancer. I also have many family members who don't know anything about it for all sorts of reasons, and people are often shocked at that. But because I was hospitalised around the anniversary of the death of my younger sister, who died in 2001 at 40, and my mum has dementia, my dad cares for her, it was like there's no benefit. They'd completely misdiagnosed my condition as uncontrolled asthma, and even the thought of me going into a scan was putting her into apoplexy. So even when I knew I was going to get surgery, it was like, no, not telling her. And they wouldn't even give me a diagnosis. So I didn't get a diagnosis until a month after surgery. Back then, there was no keyhole surgery, there were no targeted therapies, there was no immunotherapy. So the only targeted therapy were for EGFR positive, and then only on clinical trials. And I was not positive. So I don't actually know what mutations were in mine, but I had open surgery. And because I'd never had any surgery apart from tonsils out when I was 3, I'd got nothing to compare it with. And because I was fit and active, unlike now, I just got on with things. And I flew up to Edinburgh in the February and went on a flight. I didn't know you weren't supposed to fly, and all sorts of things. But because I didn't have any guidance really, I just got on with things. But I got very involved with the national charity at the time, because all the information I read, and we say about the face of lung cancer, people kept saying it was for 70-year-old smokers. I've never smoked. I was 52, just 2 weeks after my 52nd birthday when I turned up in A&E, and then, as I say, completely misdiagnosed. But at the time, despite working freelance, I was the chair of community healthcare services and a lay director on the local commissioning board for the trust that misdiagnosed me. So quite interesting really what happened. But I started to raise money after losing a friend with swimming to improve my lung health for that national charity, who invited me to a conference as a fundraiser. When I asked to go in a workshop about feelings, they pulled a face, and I said, I am a patient, and they had no idea. So I think sometimes we can pigeonhole ourselves and behave as per a label or expectations that can then do that sort of damage, if you know what I mean, for our future opportunities. So one thing I've insisted on, I mean, now it's ridiculous really, the length of time I've survived, but I've always said I don't want to be given the patient perspective on a conference program, for example, and I've asked them to change it to a different perspective. And then I just go on as either a patient advocate or a patient representative. And it can be far more powerful to reveal at the end of the story that you are the patient, rather than getting the pitying looks and the sympathy when you start off. So I think there are just many, many ways to do this. I went to ESMO patient advocacy track, and they were giving all these talks about your rights in employment. And we all know the difference between the reality of what employment law might say in one country, whether it's related to cancer, pregnancy, LGBTQ rights or anything else. The reality is quite different. And so I just threw a grenade, a comment, as I often do, and just said none of that applies to self-employment. And the woman ran after me and she said, that's really very interesting. Will you come and talk at a survivorship conference I'm running in Brussels about being self-employed with cancer? So the following year I went to Brussels and did that. But again, it didn't go on the programme that I was a patient. It just said I was patient advocate or patient representative. And we've got people on this call who may not necessarily have the condition. So I think it's about how you frame your own thing in stories where people have put my story. They've used a pseudonym, or I haven't had a photo, or it's gone on a montage. So I think for those newer to advocacy, don't be put off. There are just many different ways. And also I feared people would Google me and find these things out. Nobody ever has, or if they have, they've kept quiet about it. So I think it's just be your own person. I've got involved in immense opportunities, none of which I didn't even know this world of cancer research existed. I've been co-author on publications. I sit in highly scientific meetings and think, how on earth have I got here? But, somebody thinks I'm doing something. But around the burden of contribution is what I've started to do, a bit like Yvonne, is to try and gather groups of people who are willing to do however little even that if that's been part of a patient advisory group for half an hour in a Zoom call to put their contributions into a study, it's really useful and it helps
Yeah.
others. So start the best you're comfortable with. There are so many ways to do it, and I could speak a lot longer, but I won't hog any more.
Jeanette, you have so much fantastic advice. I think that's really helpful. And also to give the other perspective, right? You've done it not from necessarily being front and center yourself from a public point of view, but really helping very specific and very important channels. So I think that's really useful to hear. I'm mindful of the time, and I thought there will be people potentially joining this channel for another call that starts immediately after. But I thought maybe we'd do a quick fire just around with our guests today, and just like maybe go around the room quickly and just say, are there any top tips you'd share, like from what you've been doing today? Anything you would just say to anyone seeking to get involved, if you just like kept it really brief, and that way we can all get everyone in before we close. Aurora, do you want to start?
Yeah, I would just like to say that to everyone here, even if I know some people here have experience already, but if you're feeling nervous, it takes one step and then just another video and another video, another video, and you'll just start feeling better about it.
That's amazing. I love that.
Mhm.
Caleb, how about you?
Yeah, mine is from a slightly different angle. Definitely if you're from Africa, and I would happen to listen to this recording, want you to know that it's about starting where you are. You could once you feel better, and I hope and pray if you're living with lung cancer you feel better, then you can, as in talk to other, people have, in your community, talk to even the women, because you see a lot of women that use solid fuel in cooking, coming down with, lung cancer, talk to them and see how you can advocate to make the environment, cleaner and better. So that's it. And see how you can help, your community hospital or oncology center. Yeah. Thank you.
Wonderful. Thank you. How about you, Graham?
Yeah, I'd say start with what you feel comfortable with. We even just started catching up, two of us who have got ALK lung cancer in Perth, because Perth's not that big a place. We started with a coffee meeting. There's now 8 to 10 of us that all join up and catch up once a month and share our experiences with people who get it and understand us. And even starting with that will start you along, and you'll find out where you kind of fit in and what you're comfortable doing, and just make time for yourself, and yeah, just sort of balance life with trying to do a bit of advocacy if you've got time.
I love that. Thank you so much. And Summer, what about you?
Exactly what Annabelle had said earlier. Even speaking to your physician, that's the first step, right? Having your own back, which can be scary, but reach out to people that you know, do a little research, step forward, minimize those side effects the best that you can, but starting as your own advocate, and then branching out a little as you're comfortable.
And Aurora, I'm sorry, Annabelle, how about you? And closing advice.
Yes, yes, to affirm what Summer said, of course, every time you advocate for yourself with your own provider, you're also advocating for other patients that provider has. I just want to invite anyone who's here or watching this to join me as a cancer slacker. When I say cancer slacker, what I mean is, whenever someone says cancer warrior, I just want to punch them, because I feel like I can't always live up to that. And it makes me feel like I'm not achieving, and I'm failing myself and others. And I'm saying that in a joking way, but I also mean that seriously, that we need to have more compassionate language around the journey that we are walking. So just call me your local cancer slacker.
Well, you're not a slacker at all, as we said in the beginning, but I love that because I think and I remember hearing you say this in your Vienna speech that, you know, I think it was there that you talked about, we didn't ask for cancer, cancer found us. But now that we're here, let's do what we can, right? So there's so many different areas for us, and hopefully by hearing from each other, we can get different ideas and continue this valuable work. I do want to say our next episode 2 of this series is actually next Wednesday at the exact same time, and I'm really excited because we have 2 of the biggest lung cancer advocates who've really been out there making strides for a long time. Jill Feldman and also Dusty Donaldson. They are long-term survivors, have incredible stories, and really will be asking them to share all of their top tips. They've seen it all. If you can imagine what cancer was like 15 years ago, some people, Jeanette, you were talking a little bit, Jeanette, rather, you were talking a little bit about that yourself. So hearing from them, I think will be amazing. So I hope you'll join us next Wednesday. So thank you so much for joining, and I hope you found this useful. We will be posting a version of this on YouTube, and we'll promote that and take some clips here. So I really appreciate everyone's time today. Thank you again. And special thanks to our guests who were amazing. Bye, everyone.
Bye. Thank you.
Bye.
Thank you.
Thank